Let's talk about poop. Want to?
Yes.
Okay, thank you. I appreciate you saying that because most everybody else didn't look at me or make eye contact in any type of way. All right, so we're going to be talking a lot about poop today. Okay, how to poop, how to not poop, things like that. All right, so inside your gut, okay, what does your gut do? Not your stomach, your gut.
It absorbs food and medicine.
Okay, your small intestine does, yes.
Oh, your small intestine.
Okay.
Your gut also has your serotonin and your
Okay, I can agree with that. It does have serotonin and dopamine. Okay. Well, what's the main job of your gut? What does your gut do? This is a very easy question.
Digest food.
It digests food. It gets rid of waste. Don't y'all poop?
Yes.
Okay, so how do you not know what your gut does? Should we start over? Or I don't. Okay. So what does your gut do?
Digest food.
Digests food, absorbs food. What else? Huh? Gets rid of waste products. Very good. It absorbs all your water. All your water is absorbed through the gut. Okay. What about them?
Doesn't it hold sodium?
Yes, it does hold sodium. Now we moving. Okay, you just need to crack your neck again, I think. All right. Okay. So, what is it called when the gut moves? Peristalsis. And what causes peristalsis? What tells your gut to move?
Water?
Oh my God. I think I might start over.
Something from parasimpadae related.
It has its own nervous system.
Yeah.
What's the nervous system of the gut called? Starts with an E.
Enteric?
Yes, it is the enteric nervous system. So your gut has its own nervous system. It is called the enteric nervous system. It is important to note that the gut is only like one cell thick, so it doesn't take much. That's how your body is able to absorb all of those nutrients like fats and carbs and protein, right? And all the water gets absorbed that way. So peristalsis happens when something is in it, it stretches, it hits the nerves inside the gut, right? Which tells your enteric nervous system, oh, something's in there, we ought to move it forward, yes? What role does fiber play in this? What is fiber? That's not a hard question either. Y'all have heard of fiber?
Yeah.
Okay, so what do you know about fiber?
It helps with like the digestion of food.
How would it do that?
Doesn't it make it like softer?
Your stool?
Your stool?
It could, or it could not.
Doesn't it help you not to be constipated?
Depends. All right, you guys ever eaten shredded mini wheats? Okay, you know what shredded mini wheats are?
Yeah.
Okay. So you know when you first like pour the milk and you try to chew it, what does it feel like in your mouth?
It's hard.
Very hard. Okay, so
Yeah.
that's what fiber is, a bulking agent. What is fiber?
Bulking
A bulking agent. So by itself, fiber will bulk up your stool and it can cause constipation. Think if you just ate a whole box of shredded mini wheats with no water. It's just going to sit in your gut, right?
Yeah.
All right. But you wait a couple of minutes, it gets real nice and soft and it's sweeter and it tastes better and it like goes down a whole lot easier. So fiber requires water to help move things. So if you do fiber plus water, that will move, right? It's like a little, do you know what Brillo pads are? Okay. So like the things like your like grandma would wash dishes with, they're like really hard. That's what fiber feels like. And then you water it down a little bit. And then as it goes through your gut, it just kind of scrapes through your gut and helps to clean you out. That's why they say like, oh, if you're constipated, you need more fiber. But if you just gave the patient fiber, what's going to happen? They're going to get constipated, right? So you have to have fiber plus water. That's going to cause the poop to swell, right? Because you'll know like when you have shredded mini wheats and you leave them sitting in the milk for a while, they get bigger. That's what fiber is, okay? So it will swell and then it will hit the inside of that intestines and then what will happen?
You'll have to use the restroom.
Why? Why do you have to use the restroom?
Because you have all your poop at the end of your rectum. I don't know.
But fiber's happening all throughout your gut, right?
Oh.
So as it swells, it's going to cause the intestines like stretch a little bit. That activates the enteric nervous system, which says like, oh, there's something in there. Now go. We should move it with peristalsis. Are y'all with me? The same thing happens in the rectum. And that's what makes you feel like you need to poop. Okay. So as the stool sits in the rectum, it has to swell and get big enough to where it activates the inside of the rectum, hits into that enteric nervous system, telling your brain, I need to poop. Are y'all all right? Okay, this isn't a hard concept. Y'all act like this is brand new information. Y'all been pooping for a very long time, and you act like you did not know how that happened. That's what happens when I get hormones, too. Y'all act like you don't know what your period is. We're about to see. Okay, so do you understand fiber and water's role?
Yes.
Okay, so we're going to talk about laxatives first. Okay. When you are trying to determine if somebody is constipated as the nurse, what is the question you ask them?
When was your last bowel?
Okay, but what if they said it was yesterday? Am I not constipated?
How much do
No.
you poop in a day?
Or you want an amount? 12 grams. No, I don't know. You know.
Is it like if their stomach hurts?
Okay, so if I said yes, my stomach hurts, am I constipated?
No.
Oh.
How many bowels are you having in a day?
All right, let's say I have 3. Am I constipated?
No.
How do you know?
Oh, no. You're having trouble pushing?
Do I have to push? Sometimes, but not always. Do y'all understand what I'm asking?
Yeah.
Yeah.
So how do you know someone's constipated and would need a laxative? What is constipation? Let's start there.
When your feces can't move.
Okay, so it's not moving very well. So what did I say the number one job of the gut was?
To digest food.
That's not the
and
number
get rid
one.
of- oh,
What's the number one? Absorbs water, right?
Absorb water.
So as your poop just sits in there, what's it doing?
Absorbing water.
Into your body. So what's happening to that poop as it sits there?
It's absorbing all the water.
Okay, so your body is absorbing all of the water out of it. Now what's happening to your stool?
It's just getting piled.
Getting backed up?
Okay. I don't know how else to ask this. All right. You've got poop in your gut. Okay. Your gut's job is to absorb water. So if your poop is just sitting there, it's not moving, and your gut is taking all the water out of the poop, what's going to happen to that poop?
It's gonna stay,
And do what?
not move.
Okay. And
Harden?
thank you. It is going to get very hard because it's pulling all of the water out of it. So it's getting very hard and that can't move, right? Are y'all
So
with
you get
me?
impacted.
Okay. So what's the question you want to ask your patient to determine if they're
Oh,
constipated?
What kind of like if their poop? What if it's soft? or
There
if
it
it's hard?
is.
There you go.
Because all these questions y'all asked me, bleh. You could say, how many bowel movements do you have a day? I could say 3. But when it comes out, it's just one hard ball. Am I constipated?
Yes.
Yes. But if I said like, oh, yeah, I haven't pooped in like 4 days. And you're like, oh, is that normal for you? Yeah, that's normal for me. When it comes out, what does it look like? It's soft and it's brown and it doesn't hurt. Am I constipated?
No.
No. So consistency is more important than frequency. So the big question you ask is, you know, you can ask other questions too, but the big thing I want to know is, what does it look like when it comes out? Right?
Yeah.
You'll know somebody's constipated if it comes out in either hard balls, it's difficult to pass. When it comes out, it's very hard and painful. Yes?
Yes.
All right. So laxatives is a way that we're going to help people poop. Now, ultimately, we don't want them to rely on laxatives.
Yeah.
And your gut can be lazy sometimes. So if you keep giving medicine, it's going to rely on that medicine, right?
Yeah.
So these are only meant to be given like 5 to 7 days max. Otherwise, your body becomes reliant on it, and then you're not going to be able to poop without it.
Yeah.
Do you understand? All right, so we're going to talk about 4 different types of laxatives, okay? The first one is called a bulk-forming laxative. What do you think it does?
It hardens.
It bulks up, but we don't want it to harden, but it bulks up the stool so that way it activates the inside lining, which activates the enteric nervous system, which then tells your brain like, oh, peristalsis, let's move this thing. So what these are, these bulk-forming laxatives, are just fiber. Right?
Yeah.
Because you take in fiber, you drink water, you're pouring the milk on the shredded mini wheats, it swells inside your gut, it activates that enteric nervous system, and it moves. Do you understand? Yes, no?
Yes.
All right, this is psyllium or methylcellulose. You guys have probably seen this like on every grandparent's
Metamucil?
refrigerator. Every like old person has this in their cabinet somewhere. You can get it over the counter. It's that big orange jug. You know what I'm talking about? Okay, so it's Metamucil or Citracel is the actual. You know, I put the brand names on there too, just because y'all are familiar with them. Okay, but it's actually called psyllium or methylcellulose. Yeah, they put it in water.
When you stir it up, it gets thick.
Yes, that's why it says you have to take an
really
8
fast.
ounces of water, because what if they
Yeah.
only took a couple ounces of water with all that fiber?
Exactly.
It's going to cause constipation.
Constipation.
Do you understand?
I
All right, so
understand.
that's why it says side effects would be diarrhea or constipation depending on how much water you're taking in. If you don't take in enough water, you're going to get more constipated.
Constipated.
If you take in too much water or too much of this, you're going to get diarrhea. Okay. Biggest adverse effects. So, like you said, when you stir it up, it gets
It's
very thick.
thick.
So it can cause an esophageal obstruction. So you have to make
Okay.
sure they drink it immediately. Stir it in 8 ounces of water. Drink it immediately because it takes a little while to get thick. So
Yeah.
you shouldn't let it just sit there. Okay. Now it can lead to an impaction or an obstruction. So let's follow this through. Your patient gets very, very constipated. Okay. Is their poop moving very well?
No.
Not very well. All right. So when you have a ton of poop that just is like pushed in there, that's called a impaction. An impaction can lead to a obstruction where nothing is going through. That poop is so hard that it cannot pass at all.
Yeah.
And then it's going to keep growing and growing and growing. And then what's going to happen?
It's gonna rupture.
What's that called? It's a bowel
A perforation.
perforation. So it goes constipation, impaction, obstruction, bowel perforation. What is the sign of a bowel perf? It's a giant red, the number one red flag sign and symptom of the gut. No. Y'all, this is like pink frothy sputum is for
Yeah.
respiratory. Like it's your big red flag. Like if you ever see this on an exam, it's like giant red flag for the GI system. I know y'all have to know this. I've probably said it 100 times. No. Think about what's happening in the gut. That might help you. So your bowel perforated. What does that mean?
Oh,
If your bowel perforates, what does that mean?
that means there's stool inside of your
What?
blood system. No,
How'd it go straight into your blood? Where's your gut sit?
inside your stomach.
If
Oh,
your
no,
gut's in
not
your
in your
stomach,
stomach.
you're kind of screwed.
Yeah.
Okay. Can everybody point to where your gut is? Okay. Where is that? What's that cavity called? Where your gut
The
sits?
perineal.
That is your TT.
Oh.
Okay. Peritoneal.
Peritoneal.
So perineal is your privates.
Okay.
Okay. Peritoneal. Okay. So what is the number one sign and symptom of peritonitis? I'm not telling y'all because this is the only thing you have to know about the gut. Thank you. Rigid board-like abdomen. What'd she say?
Rigid board-like.
Y'all should have
abdomen.
already known that. That's shameful. Rigid board-like abdomen. That means that now if your bowel has perfed, what's inside your peritoneal cavity?
Poop.
Poop, blood, right? All of the digestive enzymes that were inside your gut are now filling your peritoneal cavity. It is going to make it hard as a freaking rock. And what are you at high risk of? Sepsis. Thank you, ma'am. All right. So this is sort of a big deal, okay? Now, these bulk forming laxatives will produce stool in around 1 to 3 days. Okay, so this is not meant for something urgent. This is like hey, I have a history of constipation. I'm feeling kind of bloated. So I'm going to go ahead and start taking this for a couple days. Okay. Now, we can also use it for diarrhea. How would you use it for diarrhea?
Because
It's a bulking agent, so we would have them cut down on the water and just take more of the fiber. We will also use it for ostomies. Like if you have an ileostomy, one that's high up, they usually have diarrhea, right? Because it hasn't had time to pull all the water out of the gut. Okay. So we can use it as a bulk forming agent for our patients with new ostomies. Okay. Administer with 8 ounces of water or juice. Why am I doing that?
No, because it bulks.
It's going to help to bulk it, right?
Yeah.
Remember, you have to have water plus fiber,
Yeah.
right? All right. Do we understand our bulk forming?
Yeah.
Let's go to surfactant. What is your key phrase for surfactant? What is surfactant of the lungs?
Isn't it the
Like what?
It's the WD-40 of the lungs,
WD-40 of
right?
the lungs,
What's
there you go.
WD-40?
the spray?
You know that spray you use when something's creaky?
Yeah.
It's a lubricant, okay? So this is actually a surfactant laxative. So it's going to lube up your gut. Okay?
Oh, the Colase?
Huh?
The Colase?
Yes, this is Colase. It'll be called docusate sodium on your MAR, but most people will say Colase. So basically, it just makes your gut so slippery that the poop just shoots right out, okay?
Yeah.
So that's why it's called the WD-40 of the gut. Now, the actual MOA is it lowers surface tension, which brings water into the stool. If water comes into the stool, it's going to bulk up, hit the inside of the intestines, activate the enteric nervous system, and start peristalsis. Very good. We got it now?
Yes.
Okay. So side effects of docusate sodium or cholase would be cramping or diarrhea if we shoot it out too quickly, right? Okay. There's a lot of people that are allergic to docusate, so they might have anaphylaxis. Give me your big girl words for anaphylaxis.
Angioedema.
Pruritus, which is itching, right?
Itching of the
Okay.
skin.
Urticaria, which is
the
hives. Wheezing, right? Okay. So you're going to watch for signs of anaphylaxis. All right. Docusate will produce a stool in around 3 to 4 days. Again, you need to take it with a full glass of water. That's a given. Yes?
Yes.
Do not use this for chronic use. If you keep lubing up that gut, it's going to require lube every time. Okay. That was a gross way I said that. We usually use this for patients on opioids. So like if we already know like they're having surgery and we know they're going to be on opioids, you start the docusate like the day they get out of surgery or sometimes even the day before. Okay. Because it takes several days to work. Do not use with appendicitis or an acute abdomen. What is appendicitis?
Inflammation in the appendix.
What's your risk with inflammation of the appendix?
Rupture.
That it ruptures. And then you've lubed up the gut. So all that poop is just going to go right through that hole.
Yeah.
Don't want that. What's an acute abdomen? Have you heard of that before?
Mm-mm.
An acute abdomen or a surgical abdomen is one in which you need surgery immediately. The sign and symptom is rigid board-like abdomen. Okay. So if they have an acute abdomen, meaning they already have like some kind of massive inflammatory response or they already have a perf, you probably ought not shoot poop through that hole. Okay. Do you understand what I'm saying? All right.
Yes.
All right. Next one is a stimulant laxative. This one
Well,
is
can I ask a
Senna.
question before
Sure.
we move on?
Mhm.
Okay, I know that the symptoms of anaphylaxis, but would they show anything else before like having that anaphylactic shock?
No, anaphylaxis happens very, very quickly.
Okay.
Anaphylactic shock just means their kidneys have shut down.
Okay.
But anaphylaxis, they'll have all those signs and symptoms, and it happens within minutes.
Okay.
Okay. All right. The next one is a stimulant laxative. This is Succinna, or y'all probably heard of bisacodyl. They used to give castor oil. That's a more natural alternative. Most of these, not castor oil, obviously, because that's a liquid, but most of them are enteric coated. What does enteric coated mean?
It's in like a capsule.
Why is it in a coating?
Oh, for the stomach to break down, right?
Not for the stomach to break down. So it's the enteric coating makes it to where it cannot break down in the stomach. It will get absorbed in the small intestine where most of our medicines get absorbed. Yes? All right. So the stimulant laxative, this is stimulating intestinal motility. You with me?
Yes.
Increases water and electrolytes in the intestinal lumen. What's a lumen? Lumen? Nobody?
I mean, it means light, right? Like a
Oh, to illuminate?
Illuminate.
Yes. But a lumen in the nursing world is like the inside of something. Okay, so the inside of the intestines, it brings more water in. If there's more water in the poop, then that poop is going to swell, and that's going to activate the enteric nervous system, and that's going to cause peristalsis. We got it? Stimulates the enteric nerves to stimulate colonic contraction. So you think this one hurts? Yeah, because it makes your stomach and move. Okay, so they're going to complain of abdominal pain, cramping. They're probably going to get a little diarrhea if you give them high dose. Okay, why would they be dizzy? It activates the enteric nervous system. Okay, so y'all have heard of a gut-brain connection? You ever had a gut feeling?
Oh, yeah.
Okay, so that's they talk a lot about there's a gut-brain connection. Like you feel a lot in your gut. Like if you get nervous, you get butterflies in your stomach, right? So there's a huge nervous system that connects your gut to your brain. So if you activate the enteric nervous system, okay, or have you ever had to poop like really, really bad? It's so bad where you like almost feel dizzy and you're shaky and your heart rate goes really high. It's because your
feel
nervous
hot?
is because your nervous system is activated. Okay. All right. Senna is a brownish color when you give it. And so it can turn your urine a brownish color.
That's
Okay.
normal?
Yeah, that's normal. Oh, I don't think I've told you all this yet. In pharm, they often test on urine color changes with different drugs, but it is never reportable because drugs can turn your urine all different kinds of colors. So it's just something we tell the patient so they don't panic, but we never report it. Because what do we want the doctor to do? Doctor, her urine is brown. Yeah. You know what I mean? Like they can't do anything about it. There's nothing to do. Okay. All right. The biggest adverse effect, because you can give these via suppository, right? Remember anything you can, I know this is going to sound gross the way I'm saying it, but anything that goes in the mouth, any medicine can also go in the rectum because it's made out of the same material. Okay. So there is a suppository that is a Senna suppository, and it can cause proctitis. What is proctitis?
Itis is inflammation.
What's a proctologist do? Y'all heard of a proctologist? Oh. It's a butthole doctor. What a day to be alive. So obviously it can cause butthole swelling, right? Because you're giving a stimulant laxative right inside the rectum. Yes. This will produce a stool in 6 to 12 hours. So we give it at bedtime. That way, by the time they wake up, they're ready to have a bowel movement. Okay. The suppositories, though, will work in like 15 to 60 minutes because your rectum absorbs much more than your even orally does. Do not give any milk or antacids within 1 hour. Y'all know I've told you that you never give any drugs with antacids, right? That's a given. We automatically know that. It is meant for only short-term use because you're stimulating the gut. And then if you use it for more than 7 days and that gut doesn't get stimulated, it'll just lay there, right? And you'll become dependent on it. Now, it is very important that you use a stool softener for 3 to 4 days first, because do you want to push a rock hard poop through their gut? You know how bad that would hurt? We don't want to do that. That would hurt very, very badly. It's like literally trying to shit a brick. Okay. So you want to give them stool softeners for a couple of days, which will soften the stool by pulling water into it, and then give them the stimulant laxative. So that way they're not having to push a brick through their gut.
So would you want to give them like the Colace, the doctor said?
But those aren't really stool softeners. Those are still laxatives. A stool softener would be something like Miralax or something like that. Okay. All right. Do not use if they have severe constipation, because you're at risk of perfing them because you're bringing a whole bunch of very hard stool very rapidly through the abdomen. Okay. All right. Do we understand stimulant laxatives?
Yes.
All right. Let's go down to osmotic laxatives. What is osmosis?
Water
movement. So what do you think we're doing? Pulling water into the
water.
intestinal lumen. What's a lumen?
Inside.
The inside of something. So that's the end. You're pulling water into the intestines, right? So this is, y'all probably heard of lactulose. Yes. There's sodium phosphate, mag citrate, mag hydroxide. You can buy these at CVS. You know, mag citrate comes in that bottle and you drink the whole thing and it like tastes really like sour. Do you know what I'm talking about? Okay.
Is that what you have to do for the colonoscopy?
Yes. You can do a colonoscopy prep. And remember, lactulose and neomycin are also the drugs of choice for... Lactulose and neomycin are the drugs of choice for... Yeah, it's a big one.
H. pylori?
Oh.
What is it? Anybody? Lactulose and neomycin. I made a really big deal about this.
Yes, you did.
Yep, I sure did. Hepatic.
It's hepatic with the kidneys. No, hepatic med.
Is it peritonitis?
Oh, that's not a thing. Where does
Hepatic encephalopathy.
Thank you. Hepatic encephalopathy. So when your liver is bad and it can't get rid of ammonia, it sends the ammonia straight to the brain. And the two drugs that we give to get rid of those are lactulose and neomycin. How do you know they're working?
Because they're pooping.
They're pooping. Remember what I told y'all? They're pooping. Yes. Okay. So it's going to draw water into the intestinal lumen. It's going to make that fecal mass swell and then soften it a little bit. Okay. So they may have some bloating, some cramps, some diarrhea, but like the colonoscopy prep, it is intense. Okay. So you be sitting on the toilet for quite some time. It can be so bad that it can cause severe dehydration. Mm-hmm. It can cause, if you do the sodium phosphate one, it can cause fluid retention because you're drinking a lot of salts, right? You can also go into mag tox if you drink the magnesium one too much. Okay. What are the 4 signs of mag toxicity? It's an acronym. Burp. Thank you. What does burp stand for? We already did this in OB. Y'all should know exactly what I'm talking about. Y'all been doing those Quizlets?
Yes.
What does burp stand for? The B.
Bacteria?
Oh my God. Ma'am. I didn't ask just any letter or any word that started with B. She's all big bird. No. What is Mama Mag?
Muscle relaxation.
Okay, so what is B? It slows everything down. Bradycardia. What is U?
Urine output down.
Urine output decreased. What is R?
Respiratory depression.
Respiratory depression. What is P?
Pulmonary.
Patellar reflexes are decreased. I don't have any DTRs. Okay. All right, so your osmotic laxatives will produce a stool in about 6 to 12 hours. We can use high dose for the bowel prep. Okay, there's a 2-hour one and there's a 6-hour one. Either way, you're going to be sitting on the toilet. They need to increase their fluid intake so they do not get dehydrated. Okay. Now, depending on which type of osmotic laxative you're going to use, you have to look at what patient population. So, like if the patient is taking the MAG one, you can't do that if they have kidney disease because now MAG isn't normally excreted by the kidneys, but they will kick in if you take too much. If the patient has heart failure, hypertension, or edema, do not use a sodium phosphate because we don't want them having a bunch of salts. Correct? Okay. And then watch for signs and symptoms of dehydration from them literally pooping their brains out. All right. Do you understand laxatives?
Yes.